Hi, this is Dr. Steve Bock. Today I want to talk about functional endocrinology, and the main topic is adrenal problems. The adrenal glands are the gland right above your kidneys on both sides. They secrete cortisone, a steroid. They secrete epinephrine, norepinephrine. In other words, they are your fight or flight gland. They're the gland that produces hormones that enables you to go into stressful modes. When you have a deficiency of the adrenal glands, now it's important to know pathologically you have Addison's disease, which is low adrenals, and Cushing's disease, which is high adrenals. Being that I've been in integrative medicine for over 35 years, I look at duality of adrenal problems going from low adrenals to high adrenals. If you're someone who is 20% above Addison's disease or the deficient point, you could have inadequate relative cortisone to handle your daily life. And this could manifest as fatigue, weakness, decreased appetite, decreased stamina, exhaustion, depression, orthostatic changes, actually go into POTS, weight loss, salt cravings, and your immune system can be decreased. What happens is you can test this. You can test your adrenal glands with an AM and PM cortisone, but that's the standard conventional methods. Rather, you can do salivary hormones, which are based on temporal measurements, 9 o'clock, 12 o'clock, 5 o'clock, 10 o'clock. Because if you have a low AM cortisol, where it should be high, you'll be fatigued. If you have a reversal, if you have a high cortisol at night, you'll be buzzed or wired. You'll still be tired, but you won't be able to sleep. So you have a disordered circadian rhythm, which is the rhythm that goes from AM alertness to getting ready for bedtime at night. Now, again, you can test your DHEA, you can test the urinary cortisols, and that will help you delineate patterns. One of the things that you do if you suspect adrenals or you want to treat low adrenals is to check electrolytes, make sure someone isn't low on their salt so they can take salt. You can also take natural cortisone, or the cortisone that your body puts out, which is hydrocortisone. Your body usually puts out 15 to 25 milligrams of cortisone. Now, that is not prednisone. Prednisone is like giving the adrenals a cannon, and you can suppress your normal cortisol production. The other thing you do is you could do nutritional treatment, which is giving the nutrients that increase the production of adrenals hormones. That would be B6, the B vitamins, zinc, magnesium, vitamin C, tyrosine. You can also go to herbs. There are certain herbs that are very good for the adrenals, like ashwagandha, Siberian ginseng, rhodiola. Rhodiola is also good because it helps the nervous system that is really distraught. So there are many ways to look at what can be looked at as weakness or fatigue in the context of Lyme, or even after your Lyme treatment if you're still having problems with energy. Hans Selye published a book called The Stress Response, in which he found the adrenals went through 3 phases. The first one is the alarm phase, which is increased cortisone to combat stress. The second one is chronic elevated cortisone, which means your markers are increased. Your DHEA could then go low. The third phase is the exhaustion phase, where your cortisol dips down and you're functioning on decreased adrenal function. I hope this helps with this topic. Have a great day.